all of you from the various county, region, and other organizations for coming to the College of Physicians, for sharing your very detailed preparedness with respect to H1N1. I think the general population should feel some sense of assurance that the medical leaders are aware of what is going on and are taking necessary steps. If there are questions from anyone in the audience, or Dr. Schwartz, or anyone else, or myself, I'd be glad to entertain you.
I just have one question. I would want to know, is there a way to determine whether you have a normal flu, H1N1, like for a mom or a parent?
The question was, is there a way to determine which type of flu? Is it H1N1 or seasonal influenza? It's a great question, and I want to emphasize two things about that. One is the symptoms should be similar, which means that it's confusing for the general public. However, there is testing available. We are not encouraging everyone to go for testing. We know that it's likely that H1N1 will be in this region relatively soon. We expect seasonal flu may come later in the year. The important issue around prevention, though, I think needs to be highlighted. So the vaccine for seasonal influenza, which does not immunize against H1N1, is available and will be available in increasing amounts over the coming weeks. It will be available. General annual flu vaccine will be available before vaccine for H1N1. We don't want people to be confused because the risk groups for seasonal influenza and the risk groups for H1N1, while they overlap, are different. Folks who would usually get a flu shot should get a flu shot. That vaccine will be available in the very near future if it's not available already. H1N1 immunization is not yet available. We don't expect it will be available until sometime in the middle of October. We know that the risk groups for H1N1, as mentioned, include particularly children and those adults who have chronic illness. For children, we talk about those from 6 months of age through, and I apologize to young adults, age 24. But all of those folks are considered at high risk for H1N1. We don't yet have the vaccine for them. We expect the vaccine from the Centers for Disease Control sometime after the middle of October.
Dr. Schwartz, could you expand a little bit on this idea of how you're going to differentiate between seasonal and H1N1? Is everybody going to get tested, and how will the counties get a handle on if we have H1N1 outbreak? Do you have something set up where you can log the test?
As we did in the spring, we expect that the first few cases where people have influenza symptoms, testing will be done for the general type of influenza. The general type of influenza, being A in particular, is of high concern because H1N1 is a type of influenza A. For tests that are positive for influenza A, specimens will be sent to the State Department of Health to confirm specific testing for H1N1, just as we did in the spring. Those tests are negative for H1N1. We'll assume that we have a strain of influenza A that is not H1N1. That would be more like annual regular influenza.
How will you get the word out to parents in schools when there is an outbreak? And once there's out, will there be the vaccine be available at school?
I'm going to suggest that my colleagues come up because we all probably have answers to this, and I'll begin. You in the media are critically important to getting the message out. So when vaccine is available, we expect that both the national folks and the State Department of Health, as well as each of the county departments of health, will make it known through media channels, as well as all of the other channels that I think every one of my colleagues mentioned. So it will be made available, it will be made known through channels that include schools and local organizations and the web, any other means available for communication under others.
There was a lot of confusion last year and in the spring with letters going home that, with different school systems and parents calling in panic whether or not they should pull their kids out of school. So will there be a procedure in place across the entire Delaware Valley, or will it differ county by county
the CDC put out very specific school closure requirements. Hopefully, everybody will abide by that. That's part of what we're doing in Montgomery County, and all of the other counties are doing the same thing. We're trying to talk to our school superintendents and let them know what the CDC has to say about school closures. But that said, that's like a war. When the first shot is fired, all bets are off. Because once you have a child that dies in the school, now you have a whole different scenario. And anybody out there that's a parent knows that that's different. So we're going to try to hold to the CDC recommendations, especially the recommendation of staying home until you're 24 hours past the temperature without any antibiotics, any fever medicines.
So what's the guidelines for who gets takes flu medication and
For anti-flu medication, we expect that it will be used for those folks who are at particular high risk of complications, for those folks who show evidence of complications. We won't be giving flu medication to the general public because this is regular influenza. This isn't influenza plus. Remember in the spring, people were very worried about the severity of this form of influenza. As you heard from my colleagues, we expect this is routine influenza. It happens to have a name, H1N1, but that doesn't mean it's any more powerful or any more dangerous than other influenza. And just as most people who get routine influenza get over it without any problem, we expect that to happen with H1N1.
A question that I would like to ask Dr. Schwartz, or Dr. Scarpone to answer, is irrespective of seasonal flu and H1N1, people still get 2 to 3 colds, upper respiratory infections per year. How does one differentiate between an ordinary run-of-the-mill cold and the beginning of the flu?
That's a good question and a good point. There's some overlapping symptoms between a simple upper respiratory infection and influenza. Influenza tends to be more of a systemic illness. So body aches, myalgia, that would be more typically seen with influenza, headaches. And I think as adults, we know what a cold feels like. We know what an upper respiratory infection feels like. If those are accompanied by systemic symptoms such as myalgia and headaches, it's likely to be influenza. I would echo what Dr. Schwartz said about antiviral therapy. We're not able to really impact on a very mild illness. And so therefore there really isn't an indication for administering antivirals for patients who are likely to have a mild illness. So we want to reserve it for those who are sicker. We worry about if there's an overuse of antiviral medications that we will have a resistance issue, and that therefore it won't be effective for those who truly need it.
What's your name?
My name is Richard Scarpone.